the main theme that we had set out was around frailty and fragility. So we know that obviously with an elderly or an aging population that we have increasing problems with spinal conditions. So we had a lot of talks, some excellent talks from the Canadian Spine Society who joined us remotely, who gave us their experience about optimizing patients, and really the best way of managing is a difficult population, but an increasing problem for us in the future. We also had some conversations around robotic surgery and where that's going. And obviously that's an exciting part of spinal surgery of where we're going with that. And it's just at the beginning of those stages at the moment. Um, and then we did have a few conversations and discussions around, obviously around COVID, how the pandemic's affected not just patients and ourselves as doctors, but also particularly in training and how it's affected the trainees and actually how it's affecting their ability to get operative experience and skills and the sort of problems that's going to cause going forwards and how we can help solve those problems. I think I've been part of obviously the BAS executive for quite a long time. I think as president, it's nice to have oversight of like everybody else in the executive of all their what we call portfolios. So I think some of the highlights certainly over COVID has made it difficult, obviously, but actually what it has pushed forward is we've certainly done a lot more education, online education with webinars, with case of the month, so discussing interesting cases from different units. And that's definitely been a highlight of improving education and bringing people together. The other area I think is around patient education. And we certainly put a lot of work into developing more information leaflets and booklets, which are on our website, which we encourage all of our patients to read when we're discussing surgery with them. Um, and I think we've done a lot. We've come together with a lot of the other societies. So with the BOA, with SBNS, and with NHS England and the Royal Colleges to try and come together and develop best practice, develop policies, pathways, which we think is going to be best for patients and also best for um, surgeons as well and for all clinicians. It's an area where there's a lot of variation in practice. There's lots of different parts of the spine which are interesting, rather than just sort of the one area. And I think technology is definitely developing. So we have a lot of advances around navigation, around robotics. And I think that will take time and it's got to be introduced in the right way so that we can, for ourselves, to introduce it safely to improve patients' outcomes, but also for trainees so that we can train appropriately with regards to sort of standard surgery, open surgery, minimally invasive surgery, and then introducing sort of navigation and robotics so we all learn going forwards. And I think there's also the aspect of the implants are always changing. The implant technology, optimizing patient care, making people recover quicker, rehabilitate quicker, and sort of enhanced recovery and enhanced care. And I think there's a lot of work that we can do and continue to move forwards. And actually we can learn. I think certainly in the UK, we can be at the forefront of that and work with sort of our European colleagues and with North America and certainly advance those technologies.